The final part of this chapter talks about maternal substance abuse and how it affects the infant. So you've had a lot, I think, with the COSAIR grant around neonatal abstinence syndrome, but just know a lot of these drugs can cause symptoms of this group of symptoms, which is known as neonatal abstinence syndrome. So with neonatal abstinence syndrome, the baby exhibits CNS irritability, respiratory distress, GI dysfunction, and autonomic dysfunction. If you look in your book on page 870, the table is 35-5. Up in the top left-hand corner, and it goes over the signs of NAS. The severity of withdrawal from any of these substance abuse is related to the timing of maternal drug in relation to the birth. So if the drug is used close to the time of birth, it increases the severity of withdrawal but delays the onset of symptoms. Okay, so it's the timing is related, the severity of the NAS symptoms is related to the timing when mom uses drugs. So if the drug is used close to the time of birth, it increases the severity of withdrawal but delays the onset of symptoms. So if you, and it's very common, you have a mom that's going to come into labor and delivery. She knows she's going to be surrounded by medical personnel, so she's going to get a hit or smoke a bunch of cigarettes or drink a bunch of alcohol. Whatever her drug of choice is, she's going to basically tank herself up prior to coming to the hospital because she knows she's not going to get any more. So what that does is when the baby does withdraw, there's a delay in the symptoms, but the severity of the withdrawal symptoms are worse. Okay, so the first drug we're going to talk about is tobacco. Tobacco exposes the fetus to nicotine and more than 4,000 other components. Results in deficits in intellectual ability, emotional development, and behavior. So, of course, I was born in 1978, and my mom tells me she smoked during pregnancy, hoping that it would decrease the weight, how much I weighed. So, there were even advertisements on the side of buses, because people used to ride the bus as a primary source of transportation, that on the side of the bus it would say smoking causes your baby to weigh less, a decrease in birth weight. Well, that was perceived as a positive, so people started smoking just hoping they would have a smaller baby. Of course, it didn't work for my mother. I ended up weighing 9 pounds 9 ounces. So the risk, if your mom uses tobacco when she's pregnant, the risk to the baby, they're more likely to be preterm. In general, babies born to moms who smoke tobacco weigh 7 ounces less than moms who do not smoke tobacco, or 200 grams, and they have twice the risk of SIDS. There's a varied relation to birth defects, so there's not a whole lot that says if you smoke, this will happen related to birth defects. Nicotine is vasoconstrictive to the placenta, and this results in fetal hypoxia and undernourishment. So when the blood vessels in the placenta to the placenta are constricted, the babies don't get all the nutrition that they need or all the oxygen that they need. Nicotine is secreted in the breast milk up to 2 hours after birth, and also is known to cause a low milk supply. So moms who are smoking might have more difficulty producing enough milk. You always want to be cognizant of secondhand smoke exposure and teach patients about that. Smoking cessation during pregnancy is important, and so, some drugs you don't want to stop cold turkey during pregnancy because that increases the risk of miscarriage and withdrawal to both the mom and the baby, but smoking cessation is not one of those. Smoking cessation is encouraged during pregnancy. And then after birth, it's important to teach moms and anybody who cares for her baby or around her baby to not smoke around the baby. So go outside and smoke. And even it's important for them to change their clothes before they hold the baby because clothes can absorb secondhand smoke. Next is alcohol, and we're going to talk about alcohol and its relation to fetal alcohol syndrome or fetal alcohol spectrum disorders. So, this is one of those disorders that there's not an equation that says if you drink this amount, this is what will happen to your baby. So that's why it's a spectrum, because a little in some people can cause worse outcomes, or some people can drink more and the infant has not as much delays later. So, alcohol easily crosses the placenta, and we know the quantity affects the outcomes. But again, there's nothing that states if you drink this amount, this is what will happen to your baby. So it's one of those, there's not a minimum amount that's considered safe. No alcohol is considered safe. Signs and symptoms in the infant include jitteriness, increased tone and reflex response, and irritability. So these babies are just irritable and have a lot of neuroactivity. The signs of fetal alcohol syndrome. The signs, they have to have signs from 3 different categories. So first is prenatal or postnatal growth restriction. Second is some type of CNS malfunction, or cognitive impairment. And the third is craniofacial features. So those include microcephaly, small eyes with short fissures, a thick upper lip, a flat midface. I'm sorry, that's not a thick upper lip. A thin upper lip, a flat midface, and an indistinct philtrum. So a thin upper lip. So look at those craniofacial features, and I know I slaughtered saying a lot of those words, so just take a minute in your book for me and read over those craniofacial features, and definitely be aware of those. So ARNDs or ARBDs, these infants are exposed prenatally who are affected, but they don't meet the criteria for fetal alcohol syndrome. So they have some signs and symptoms, and those acronyms are this alcohol-related neurodevelopment disorders or alcohol-related birth defects. So these infants are exposed to alcohol prenatally, and they do have some effect, but they don't meet the full criteria for fetal alcohol syndrome. They're actually not, often the diagnosis is delayed until school, and then when they have problems learning. This slide just shows critical periods in the human embryogenesis, so essentially what drugs, when you take them at the stage of development, cause irreversible adverse effects. The next drug we're going to talk about is heroin, and with heroin, many of the medical complications are attributed to heroin or a result of prematurity. So a lot of babies born of mothers who use heroin are premature, and the sequelae from that are related to the prematurity. So we know that heroin crosses the placenta and causes IUGR. The risk includes stillbirth, meconium aspiration, increased neonatal death, microcephaly, neurobehavioral problems, and SIDS. Heroin withdrawal, which is same symptoms of neonatal abstinence syndrome, occurs in the majority of infants born to addicted mothers. If the mother is on methadone when she's pregnant, it improves perinatal outcomes. And this is one of those drugs that detoxification during pregnancy is not recommended. The NAS symptoms usually occur within 12 to 48 hours of life. Signs and symptoms of heroin withdrawal include the baby will be depressed, or jittery and hyperactive. They have a shrill and persistent cry. They yawn, sneeze, have poor feeding and sucking, diarrhea, temperature instability, and sweating. The babies are treated with phenobarbital, methadone, or clonidine. The next drug that moms would be considered substance abuse during pregnancy is methadone. The thing about methadone is it's essentially a controlled substance. It basically replaces, it's just a legal way of replacing heroin. There's a lot of controversy around the use of methadone. We know it improves outcomes. Patients are more stable on it. The babies do better, but if it's sometimes, you get switched from heroin to methadone and you're really never able to come off the methadone. So if you don't get your methadone, you still have the same signs and symptoms. If you don't take it, you still have the same cravings. So essentially methadone is a synthetic opioid, which has been the therapy of choice for heroin addiction since 1965. Methadone withdrawal resembles heroin withdrawal, but tends to be more severe and prolonged. Therapy for methadone withdrawal is similar to therapy for heroin withdrawal. So again, it's just a synthetic form of an opioid, so it just takes the place of heroin. But, aside from it being legal and controlled, it's not much better.